Hello, everyone. Welcome to India's second Metabolic Health Conference. My name is Priyanka Matanhelia. I'm a metabolic health coach and a member of DLife.in, India's oldest, biggest, and the only award-winning low-carb platform. Shashikant Iyengar and Anup Singh have organized this historic and scientific feast from India titled Metabolic Therapies. Let's meet our very special guest for this session, Dr. Shabnam Das Kar. Dr. Kar is a consultant in functional and metabolic medicine. She works as a director of medical education at Better Medical Center, Calgary, Canada. She's a fellow of American Academy of Anti-Aging Medicine, a brain health coach. She's also a certified tiny habits coach. She has worked as an obstetrician gynecologist in Mumbai, India, for more than 20 years before her transition to functional medicine. She's also an advisor to health tech companies. Welcome, Dr. Kar. Welcome to the session. Could you tell us a little bit about your journey into metabolic health practice from a practicing OBGY to a functional medicine expert?
Thank you, Priyanka. That was a very wonderful welcome. Thank you, everybody. And Shashi and Anup, thank you for inviting me as a guest. It's my honor and privilege to be here. So I live in Alberta in Canada, but I'm originally from India, Mumbai, actually the very city where this program is being hosted. So I was an OBGY more than 10 years ago, delivering babies, doing surgeries, taking care of women with PCOS. But it's a long journey, so I'm going to cut it short. I was introduced to bioidentical hormones when I listened to a doctor from the US who spoke at an event. And I thought, I'm an OBGY. I don't know anything about bioidenticals, and I've not heard of these things at all. So anyway, over the course of the journey, I got a fellowship from the American Academy of Anti-Aging Medicine. And then I realized this is a much better way to practice medicine. In that time, we moved to Canada, and I realized I like practicing medicine this way a whole lot better than what I was doing before, which was essentially recommending, medicines or surgery. In OBGY, we didn't have a whole lot of prescription medications. And I took care of a lot of women with PCOS back then. But what I know today about PCOS is a whole lot more than what I knew then. And my topic today, PCOS and mental health. Back then, 10, 12 years ago, I had no idea women with PCOS had so much of mental health challenges. So as you know, Priyanka, we talked about this before.
Yes.
Women with PCOS have more anxiety, more depression, more mood issues. And even if I knew back then, all I would have done is send them to my psychiatrist colleague across the corridor, and he would have put them on some medications. Now, Nicole, who was speaking just before me, I was just nodding my head in the background. It's not like I am anti-medication. I am trained in medicine. But not everybody needs a prescription medication for mental health challenges as the first line. So over the years, of course, my transition has been from prescription medications, surgeries to functional medicine looks at the whole patient. And in our view now, and it's not just functional medicine, and Nicole talked about it too, we look at mental health challenges as problems of brain health. So brain health and mental health are intimately connected. So yes, it has been a major paradigm change in my thinking. And if many of you listening to this, you're thinking, oh my God, this is what my doctor needs to know. Yeah, for sure. But change is not easy. It is hard. It takes time. And this is a completely different way of thinking more than anything else.
Right. So, yeah, and in fact, actually, as you mentioned, PCOS and mental health, that is our topic for today. And, in the last few days, as you must have seen in the news, PCOS has received a lot of attention in the media. In fact, because, there was a young woman who topped the UP board exams and she was trolled for her physical appearance, for her facial hair. So I think it's, today, even today, like you are saying, you are a doctor, so you still knew about the condition. But I think general public, they're still not aware that PCOS is a medical condition. And, all these facial hair is not a matter of grooming, for which she was being trolled. So I think if you could explain a little bit about what is PCOS and how it can be understood in young women, how it can be diagnosed, it would be very useful.
Yeah, you brought up something very important, Priyanka. And when you posted that on LinkedIn, I felt really sad. So, what Priyanka is talking about is this young woman. She is a class 10 topper. So, she must be 15 or 16 years old, who has excessive upper lip hair. And she was trolled because obviously people don't understand. And the other thing is, mental health challenges. Obviously, why do women with PCOS have more mental health challenges? Something we need to think about, because there are two kinds of problems here. One is biological, which I will talk about: insulin resistance and brain glucose metabolism. But the other part, which in India has a, and not just in India, anywhere in the world, in India, it's really huge, is the social cultural aspect. It's like when I moved to Canada, for the first time in my life, I heard about, people talking about people first language. So instead of saying, look at that girl with a mustache, because a mustache is something associated with men. How about we talk about this girl who has a health condition? Okay, I understand not everyone will know, but she has excessive upper lip hair or something like that instead of, and then, how it's so easy for people to say that fat person. And, Hindi movies have also not contributed very well to that, because they make fun of people who live with a higher than expected body fat percentage. But instead of calling that person, oh, that obese person, people first language would say the person living with obesity, or a woman with PCOS. Now, if she doesn't want to be identified as a woman, we should respect that. Let's say she uses a different pronoun. Now, this awareness, Priyanka, thanks to, I think, technology and social media, hopefully things will change, the judgmental and, that entire thing. So women with PCOS and the mental health challenges, as I said, the cultural part, then the obsession with, fertility, and younger women should get married. Now, women in their, 20s and 30s in India today, I don't think many of them are thinking of getting married very early. And that is something society finds very difficult to accept. I mean, my generation was different. It was considered the norm. That causes a lot of problem for these women, because at home the conversation is constantly like, when are you going to get married? And when are you going to, when they get married, it's like, when are you going to have children? Maybe that's not the thing. So, Priyanka, to talk about the diagnosis of PCOS, I'm just going to share my screen. And why I want this to be highlighted is, I find many patients, so I do practice in India, in the sense that I have a telehealth practice in India. So I live in Canada, but most of my patients are from India. So diagnosis is very important, because what happens is a lot of women self-diagnose PCOS. And that is kind of, I mean, many people will think, oh, she's just a nitpicking doctor. But the thing is, unless we identify something accurately, we cannot provide the best treatment for them. So when we say that a PCOS diagnosis has to meet two of the following three criteria. So clinical or biochemical hyperandrogenism. Now, I'll just explain. I know in medicine, we love big terms because it makes us sound very clever. So hyperandrogenism, meaning excess amounts of androgen hormones. Now, I don't like calling androgen hormones as male hormones, because even women without PCOS make hormones like testosterone and DHEA. So one is biochemical, which is evident on blood tests. The other is clinical. So this young girl you mentioned, who has hair growth in, excessive hair growth in areas where hair normally doesn't grow, like upper lip and chin and a lot of other areas. or they have acne, or they have, what is called female pattern baldness. So basically, overall hair growth is less. They have like wider partings. That is one criteria. The next is evidence of oligo-ovulation. Oligo meaning less. Ovulation is every month woman's ovary, either the right or the left, an ova comes out, and that moves into the uterus. If she gets pregnant, she won't get a cycle. So this ova coming out is called ovulation. So women with PCOS, many of them don't ovulate regularly, and that is one reason which contributes to fertility problems. The third criteria is polycystic appearing ovarian morphology on ultrasound. And again, of course, we have to rule out the other problems that might be there. Now, polycystic ovary in India, what happens is no one needs a doctor's prescription to go to an ultrasound clinic and get an ultrasound done. So many women have told me, I have polycystic ovaries. I said, okay, on what basis were you diagnosed? Oh, I have polycystic ovaries on ultrasound. That is not the only criteria. So that is important because many women think they have PCOS where they actually don't have. And then there are other women who have PCOS but don't know it because they're not diagnosed. Now, the fact is the underlying problem in PCOS, because it's a very complex neurohormonal problem. And now, back when I studied medicine a long time ago, back then we did not have so many women with PCOS. Now I think it's 1 in 4 or 1 in 5 women.
1 in 5, yeah.
Yeah, that's a very, very high incidence. So obviously, our genes did not change in the last 20, 30 years. So what changed? So though we don't know the exact cause, it's not one cause, most chronic diseases don't have a single cause, it's multiple things. Genes are a factor, but it's not a single gene, it's multiple genes. The environment, what has changed? One of the big things that has changed is our food environment, then the amount of toxicities we have, hormone disrupting chemicals. And as Shashi was talking about India being the diabetes capital of the world, so metabolic dysfunction starts much earlier in people of South Asian origin, people from India, Pakistan, Bangladesh. And there is no one single reason. There are multiple reasons. And most of the reasons are not because someone is just lazy and they just eat junk food. It's not a personal shortcoming. So while the underlying problem in PCOS is insulin resistance, now I'm sure a lot of people wonder, why is insulin resistance not included as a diagnostic criteria? And it's not that doctors are idiots, It's that insulin resistance, for it to be tested accurately, requires a very fancy research tool called hyperinsulinemic euglycemic clamp. Now, don't bother about knowing the name. And you can't just go to a lab and say, I want to do that test. So that is the reason. See, whenever any medical society comes up with criteria, it has to be applicable equally all over the world. So yes, insulin resistance is the underlying problem. And in fact, some people describe PCOS as diabetes of the ovaries. So that is sometimes easier to explain, just as fatty liver is diabetes of the liver. Cardiovascular heart disease, stroke can also be called diabetes of the blood vessels. So in the absence of insulin resistance specific testing, what can we, how can we know whether someone has PCOS? So I'm just going to share, these are the numerous reasons. So what are the indicators of insulin resistance? And I'll leave that slide on for a little while because this is not just in women with PCOS. This applies to anyone else looking at metabolic dysfunction as well. One of the commonest ones is belly fat. And Indians, as you probably know, have the problem of being TOFI, thin outside, fat inside. They have more metabolically unhealthy fat. So you'll see quite often it's like, it's a man, very often it's a man who's his muscle mass is very low. So his, he doesn't want to wear shorts because his legs are very thin, but he has a belly protruding. Now, overall, you'll say that, oh, this person is not overweight. Yeah, but they have metabolically unhealthy fat. And similarly with women, I've had women tell me, I don't have a weight problem. I said, yeah, you don't. But then, your belly fat is there. You can't ignore that. And easiest to know, because if you don't have a weighing, measuring tape or anything, half of your height should ideally be your waist circumference. And if that is not, regardless of whether you think someone thinks they're fat or not, that is something that needs to be considered. The other thing is fatty liver, as Shashi was talking about just a little while ago.
Right.
Fatty liver is like an epidemic in India, and
Right.
it has, most people don't connect their metabolism to fatty liver. So that is again something very concerning. And again, high triglycerides. I mean, it's so common in India. People talk about everything else in the lipid profile, but not the high triglycerides are very concerning. And a lower carbohydrate food, omega-3 fatty acids, those are the important ones. Primary hypertension, again, is very important. So I'm going to stop sharing my screen. So Priyanka, what would you like to know
So
more about?
yeah, so I think it's very clearly that you have established that, PCOS is basically related to impaired metabolism. So it's basically metabolic health that is very, very
Yeah.
important. Now, if you could just expand that too, because, mental health, as you said, the other day I met a lady in the park and she was telling me that her daughter has PCOS. And I said, oh, she must be having, just said in PCOS, people have mood swings. She said, oh, that's why she's going high and low all the time. She's in depression. So I think people don't understand the connection with mental health and PCOS. So if you could just explain that also.
Yeah. So like you said, and I mentioned earlier, mental health is brain health. So one of the things that studies have shown, this is studies when they use what is called an FDG PET, where they look at the brain's glucose utilization in women with PCOS. This was a small study, but it is significant nonetheless. They found that women with PCOS have a lower capacity to utilize glucose in the brain. And this brain glucose hypometabolism, again, my apologies for the big words, but basically it means the brain's capacity to not be able to use carbohydrates as a fuel. This problem happens even not just in women with women with PCOS. It also happens in the menopausal transition, and it
Right.
also happens in mild cognitive impairment, that is pre-Alzheimer's disease. Now, I don't want women with PCOS thinking, oh, that means Alzheimer's is in my this thing, but yes, it does increase the risk. So one is brain glucose hypometabolism, which impacts brain health and mental health. Another big thing is, our brains are big energy hogs, which means the brain it just weighs 2% of our body weight, but uses up 20% of our daily energy requirement.
Wow.
And the other big energy hog is our immune system. And every disease is actually an immune system problem. So what happens with, mental mood issues and, PCOS? One is the insulin resistance. The second is, if we go back to the food that people eat now. Now, Nicole, who was speaking before me, talked about mitochondrial health. Now, for mitochondria are these little, and organelles inside our cells which produce ATP. ATP is the energy in our cells, so cellular energy. So brain uses a whole lot more energy. And for mitochondria to produce adequate energy, it needs a whole bunch of micronutrients. So it's
Wow.
things like B vitamins, magnesium, zinc, iron. Iron deficiency is so common in India. B complex, B vitamin deficiency, D, vitamin D. If someone is not supplementing,
Right.
they are not going to maintain their vitamin D levels. Omega-3 fatty acids. So if all those nutrients are missing from our food, that is definitely a cause for concern. Then the other thing that happens is, for a lot of people, they don't prioritize sleep. So particularly young people, they think I can, stay up the whole night and sleep for just 4 hours and go back to work in the morning. Now, sleeping shorter duration can actually cause conditions like depression. This is, in psychiatry, you don't often hear people saying something causes something, So
Right.
those are the other things. So which are the particular areas which are bothering them? Another big one for mood swings is As we all know, PCOS is a problem, is a hormonal imbalance problem. So hormones like progesterone, estrogen, testosterone, cortisol, these are also produced locally in the brain. So if a woman with PCOS does not have, let us say she does not have adequate progesterone, that's why she's not cycling every month. So that can cause problems of anxiety as well. So progesterone makes something called allopregnenolone, which is what is called a neurosteroid, basically neuro meaning nerve tissue, and steroid is the chemical structure. So if they don't have adequate, progesterone, or there is an imbalance between the amount of estrogen and the amount of progesterone, that can cause mood issues as well. And high testosterone can do that as well. So it's not just one simple thing, it's
Right.
multiple things. And most people don't connect. Like even today, unfortunately, a lot of people think, oh, she just needs to think positive. And I keep saying,
Right.
and so Priyanka, I tell people, I said, I have not met a single person until today who wakes up in the morning and decides, I'm going to think only negative thoughts today. So
Right.
depression, anxiety, these are actual medical problems, just as diabetes or hypertension. And this is, and including, people living with a higher than expected body weight, people think, oh, they're just lazy. They just eat too much.
Mm.
They don't exercise enough. That thinking has to change. And I'm sorry, Priyanka, that has not changed even amongst a lot of the doctors. They still think, oh, this person is like this because they eat too much, they eat too much junk food, and they don't exercise. They are lazy, they don't have, the motivation, they need a lot of will force. So that is
Yeah.
basically what a lot of the thinking
Yeah.
goes.
Yeah, in fact, even like now that I'm guiding even the older women, they carry this guilt. They
Yeah,
still continue to blame themselves
yeah,
for, that it's my habits which are wrong, or I'm not doing
yeah,
something right. That's why.
yeah,
So, as you were saying earlier to me also, that PCOS is a lifelong condition. So, if you
yeah.
could explain that, because as you said, it's not something that, just happens in young women and remains with them at that time, but it carries over to later. So
Yes, that is again something that is number one, not talked about as often. And for women, this judgment and this, thinking that I am less than something else is or someone else is like so pervasive. And we didn't even today, I don't think in medical college we are being taught about these things. Back when I studied medicine, we were not taught about how your childhood, how nurturing relationships, if you had a lot of severe mental health challenges in the family, and you had, let us say, you had an alcoholic parent, how that impacts long term health, and how women are so often made to feel less than something else. It's like
right,
there's a lot of work we have to do. We are not there yet. So what you said is very true. So number one, there is no specific cure for PCOS as of today. I'm saying as of today because there's a lot of research going on. But and it's a lifelong condition. So what do I mean by lifelong? So a lot of women, are diagnosed with PCOS when they are in their teens. They have some irregular cycles, they have hirsutism, and their mother takes them to the gynecologist, and they come up with a treatment, they come up with a diagnosis of PCOS after having an ultrasound, and then they are put on birth control pills to regularize their cycles. Now again, I'm not going into that, that's another story because we'll run out of time, Priyanka. So the thing is, in the adolescent years, a young girl in her, teens is not concerned about fertility, or not concerned about, endometrial cancer or heart disease down the line. She is thinking of, how can I look better? How can I get rid of my acne? How can, I wear better clothes and look good about it? Or they may also be having eating disorders or food addictions, which, and like you said, mental health challenges. Young hypertension is very common in India, and often it is not diagnosed because young people don't have their blood pressure checked. So, depending on the age, then comes young adults. Now, some of these women may be interested in getting pregnant and starting a family. Then, fertility becomes a bigger issue, and all these things are still there. in the perimenopause and postmenopause, everything kinds of, sort of just keeps on adding up and adding up. So the other thing that happens during the menopausal transition, now when I say menopausal transition, I need to clarify what it is. The 8 to 10 years before menopause is called the perimenopause. That is a
Right.
time of where hormones can be really wildly fluctuating. So that is a time when women have another problem, which is a metabolic dysfunction. So there are estrogen receptors in the pancreas, which produces insulin, and women also lose muscle mass. And muscle mass in South Asians is a big problem, and muscle is a big glucose sink. So when we talk about insulin resistance, we need a good glucose sink. So building muscle mass is very important. So women with age start losing more muscle. Along with the metabolic dysfunction, it has been going on for much longer. So women in the perimenopausal transition have really a lot of challenges with losing weight, or they end up gaining more belly fat. And they have one of the commonest symptoms of menopause is brain fog, sleep issues, chronic insomnia. All those sort of contribute, and like it becomes very difficult for people to manage all that, and particularly if they are not getting the kind of support they need.
Mm.
So
So
yeah,
that's,
there's
yeah. Yeah, I think, these are like a lot of symptoms which we can actually ignore very easily.
yeah,
So I think it was very important for people to know. But earlier you also mentioned that there is no curative treatment for
yeah.
PCOS. So in such a scenario, what could women with PCOS do? Like what kind of, because we talked about like they can follow some nutritional strategies, especially low carb strategies and habits. So if you could talk about that.
Yeah. So, in the absence of definitive curative treatment, the best we can do is manage symptoms. So, in managing symptoms, insulin resistance is a problem where the hormone insulin does not function as well as it should. And as most of you know, insulin is the hormone that regulates your blood glucose levels. So, women with PCOS have that challenge. So, obviously, eating more carbohydrate containing food will impair the insulin carbohydrate metabolism even more. Now, how much carbohydrate does someone eat? It depends. And as you know, in India, even people who are vegetarians, and you are a former vegetarian, vegetarian people in India don't eat vegetables and fruit kind of stuff. They
Yes,
eat a lot of grains. It's
right.
like roti and not so much maybe rice, but it's not what the in countries like Canada, vegetarian food involves a lot of vegetables. But
Vegetables, right.
in Indian food, that's usually not a primary one. So
Yeah, Shashi
starting
has
with
a, yeah, no, sorry.
yeah, go ahead.
Shashi has a term for people who eat grain called grainitarian.
Yeah, they're
So
predominantly grainitarians.
vegetarians,
And even
yes.
actually, people who do eat non-vegetarian food in India, it's not like they are eating non-vegetarian food every day. It's like maybe 3 meals in a week or something for some of them. So, anyway,
Right.
we don't have a lot of time, so I'm going to go ahead and tell you what are the strategies. Food is, of course, primary, and eating a lower carbohydrate food than what they were eating before. Now, the last conversation was a lot about ketogenic diet as well. So, one thing I want to clarify, a lot of people mistake a ketogenic diet for being a high fat diet. No, that is not the definition of a ketogenic diet. A ketogenic diet is a carbohydrate restricted diet, and the restriction definition has to be very clear because it's like as little as 20 grams of carbs in a day. So 20 grams of carbs, Priyanka, one apple is 20 grams of carbs. One roti, I have a slide where I talk about the different lentils and things like that, how much carbs they have. So how are we going to talk about lower carbohydrate diet? Maybe even if they don't reach a ketogenic level, how can that be implemented? So I talk about food in terms of a few things. I will share my slide. Okay. So first is when it comes to food, what is someone supposed to eat? Rather than focusing on let us say someone is eating 300 to 400 grams of carbs a day, which is quite common in India. Instead of saying, don't eat this, don't eat that, the don't list goes very long. How I like to start is you need to prioritize protein. Now, in food, there are three macronutrients: proteins, carbohydrates, fats. Now, amongst proteins are made of amino acids. Some amino acids are called essential amino acids. That means our bodies don't have the ability to make them. But and there are some fats like omega-3 fatty acids, which are essential fatty acids. Our bodies don't make them. So if our bodies don't make them, obviously they have to come from food and supplements. Third is carbohydrates. There are no essential carbohydrates. We can live with very little carbohydrates. See, there are small amount of carbohydrates in vegetables, so it's not like you're eating zero carbs, but you're eating a whole lot less because our bodies have the ability to make carbohydrates. So even the brain can function very well on ketones, which is an alternative fuel. So instead of focusing on what I can't eat, I ask patients, so what is your favorite protein? Now, it depends. If they are vegetarian, then obviously paneer or tofu may not be some women in India don't even like tofu. They don't eat tofu. They would definitely need a protein supplement to get adequate protein. If they eat non-vegetarian food, I ask them, which one's your favorite? Like, is it fish, meat, eggs? So first you prioritize protein. Now, when I say adequate protein, this is again, there are so many misconceptions. If you eat too much protein, your kidneys are going to get fired. Not true. Data doesn't support that. So when I say adequate protein requirement varies depending on someone's physical activity level. Someone who's more physically active wants to build more muscles, that person will need more protein, but a very basic level is 1 to 1.2 grams per kg body weight, which means a person weighs 80 kilograms, they need to have 80 grams of protein in a day divided over 2 to 3 meals. That is not easy because the other thing that happens is protein and good fat are very satiating. So they keep hunger away much longer versus high carbohydrates will make a person hungry very soon. And in our world, we say they become hangry. So they're hungry and angry at the same time. And what happens is if you look at the glucose curves with carbohydrate containing food, it goes up in 1 hour, 2 hours, stays like that, and then dramatically falls. This wildly fluctuating blood glucose levels also cause mental health challenges like anxiety, panic attacks. There is something else called relative hypoglycemia. We won't have time to go into that. Basically, when I say prioritize protein, how we serve ourselves the food. So in Indian food, usually what happens is the roti or the rice that is served first. So instead of doing that, start with whatever your favorite protein is. If it is paneer, or if you're eating non-vegetarian, chicken or fish or eggs, whatever, and some high quality, good vegetables. Now cook the vegetables in whatever spices you want, your family's favorite recipes, but make sure the oil in which it is cooked is not one of these inflammatory seed oils. So using ghee, butter, or I ask patients, what is your ancestral oil? Like, what did your great-grandparents, it's not even grandparents anymore, it's great-grandparents have to ask about. What did if they ate coconut oil, can you get the minimally processed coconut oil? In India, what happens is even, let's say someone's traditional oil was mustard oil, but getting a less processed mustard oil, like a kachi ghani mustard oil, that would be much better. Ghee and butter is fine. Contrary to what a lot of people are still in the low-fat world. That doesn't help. So the next thing that I talk about is when. So TREIF is time-restricted eating, intermittent fasting, and ETRE is early TRE. TRE is eating in shorter windows of time versus eating throughout the day. Now, people will say, I don't eat throughout the day. I said, no, you actually need to track it. So eating good, nutritious meals 2 to 3 times a day versus eating 3 meals and 3 snacks, as a lot of dietitians used to recommend, even today, some of them recommend for weight loss, that doesn't work as well. But some women, particularly if they have a lot of body fat to lose, they may need intermittent fasting. So intermittent fasting is a fasting interval of 24 hours or longer. Sometimes people have to start 24 hours fast once a day, slowly, gradually increase it to 3 times a day. But I would not recommend anyone do that without supervision, because you need to know how to fast correctly. Just getting into, just doing a deep dive into a long fast without knowing anything about electrolyte balance and all those things, that can be not very pleasant, and particularly someone who's on multiple medications with diabetes and all that. ETRE is eating earlier in the day. So this is when, in India, as you know, Priyanka, people have dinner. I know it's not you, but a lot of people have dinner very late in the evening.
Right.
So, working out practical
We're not gonna share,
strategies.
but just gonna check the option.
Sorry.
Okay.
So
So it's really disabled it automatically.
I,
But this
I
would
think.
be the screen, the share screen.
Right.
Mhm.
And then I'll
Oh, okay.
probably see
Oh,
Kumran.
no.
I'm sorry.
You would only
Someone's unmuted. We're getting some
Mm,
background.
Yeah, it's fine now. Yeah.
Okay.
Hmm.
So I was talking about when. So eating higher, let's say it's someone who cannot give up their rice or their roti. So what I tell them is, okay, have that during lunch. Make sure that for supper or dinner, you don't have a lot of carbohydrates. Prioritize your protein. So serve yourself protein first, and there's not a lot of space left for carbohydrates. Early dinner is something that most of my patients find it makes a huge change. And for some people, they might just have to carry an extra meal to the office, because in a city like Mumbai, most of them won't reach home by 7:38. So what I
Right.
tell them is, finish your meal in the office and then you leave for your long commute, so that you don't reach home at 10 o'clock and then you're left with eating.
Mm.
In what order? Eating
Mhm.
protein before carbohydrates changes blood glucose response dramatically and also increases satiety. So satiety is basically not feeling hungry. So proteins increase satiety dramatically, and that can change the amount of. Now, though I know I always say calories alone don't count, but automatically when someone starts eating more protein and they practice TRE, the total amount of calories they eat becomes a whole lot less. So protein before carbohydrates, and people can try this out using a continuous glucose monitor. So they use a CGM and they see what happens when they eat protein first versus. There is a reason why restaurants serve bread first, so they want you to order more food. And no naked carbohydrates. I wish there was another term for naked. I studied in a Catholic missionary school, so I don't think I like the term very much. But basically, don't eat carbohydrates by themselves. So what do I
Right.
mean by that? Let's say there is this wonderful gulab jamun you want to eat after lunch, or your mother has made them. Make sure that you eat, your whatever your favorite protein is, and have that gulab jamun at the end of the meal, rather than, oh, my mother's just made them and they're hot gulab jamuns, I'm going to have that first. So there are many different ways of using these strategies. And Priyanka, how are we doing for time?
So we are fine. I just
Okay.
have a couple more questions to what you are
Yeah.
talking about. So in terms of, carbohydrate restriction, I think there's one popular perception that carbohydrates are very important for brain functioning. So what is your
Mhm.
view on that? Like, because, that is the first pushback that comes from people.
Yeah. So our brains, like I said earlier, can work very well on ketones, because see, if you think back to our hunter-gatherer ancestors, they did not live in this world of plenty. Now we have very easy availability of food. 2 clicks on a phone app and you have food delivered right to your door in Mumbai, how long is it? 15 minutes? Yeah.
Yes.
Yeah. So it was not like that. So there were
Right.
times when we had famines, and there were times when we had plentiful food supply. So our mother nature did not design our bodies where we are going to die because we don't get carbohydrates.
Right.
So body is naturally tuned to getting used to fasting, and every religion in the world has religious fasting. Now that's another story, because Indian religious fasting ends up late at night with a high carbohydrate meal. That is not what I'm talking about. But our bodies are used to the fasting and the feasting. Our genes were not designed to eat all the time, day and night. And like I
Right.
said, our bodies have the ability to make carbohydrates. And so it's not, that is not true. So the brain
Okay.
can function on
Function.
ketones, number one. The second thing is our bodies have the ability to make carbohydrates. Carbohydrate is not an essential nutrient.
Nutrient. That's thanks for clarifying that. Another thing is, as you said, the habits, our habits are the most important, barrier in our the changes that we want to make. So as a tiny habits coach, what would be your one or two suggestions for people to, how can they manage that?
Okay. So in the tiny habits, so tiny habits method is a method of behavior change, which comes from the work of Dr. B.J. Fogg, who's the head of behavior design lab at Stanford. And what he found based on his research is he has a few maxims. One of the maxims is help people do what they already want to do. And the second maxim is help people feel successful. So when I say help people do what they already want to do, I have so many patients coming to me, and women in with PCOS in India, most of them are living with a higher body fat percentage. And the first thing I asked them, this is now, back then when I was, an OB/GYN in Mumbai, there was no conversation about what is it you want. So I asked them now, is weight loss a goal for you? If that is not, let us not talk about weight loss at all. Some of them say no. I said, what bothers you the most? Is it hirsutism? If it is hirsutism, then let us focus on how you can get the best possible strategies. You need to meet a dermatologist, find out what kind of, I'm not a specialist in that. Find out what is right for you, because making a person feel good, what it does is, yes, all of us want to feel good, but it sets them up for doing more difficult things. Because
Right.
changing food, changing lifestyle, these are big things. They are not, and again,
Right.
depends on what kind of, are they living alone? Does their mother decide what is cooked? And then I tell them, bring your mother to the consult, because me telling you anything about food is not going to matter, because your mother is going to say, you need to eat protein.
Yes, I think
So,
that's a challenge, from the Indian perspective.
yeah.
I would like to invite Shashi Iyengar and Anup Singh now for, just to thank Dr. Kaur. And yes.
And I can see Dr. David Diamond. I believe he's your next speaker.
Yes.
Yeah. Dr. Shabnam, thank you very much for coming in this conference and sharing a valuable insights into this topic. And I think that is very much required, because especially the PCOS, 1 in 5 in India actually have PCOS without, many of them may not be knowing also. And
Yeah.
of course, related to insulin resistance, obesity, lifestyle, as you explained it very nicely with all the slides. So I want to once again thank you. Thank you very much. Yeah, Anup.
Thank you, Shashi. Thank you very much. My pleasure. Hi, Anup.
Anup, we
Anup
cannot
Singh.
hear you.
Yeah,
You need to
can't
connect
hear.
Yeah.
something. He needs to connect it.
Yeah, thank you, Dr. Shabnam, for
Yeah.
coming.
My
Thank you for
pleasure.
coming and taking our invitation. It was a nice session to watch. And to put on record, few days back, Priyanka had tweeted one tweet. Now that
Yeah.
has been covered in almost all media and she has been quoted all around. It was on PCOS. So it's a great coincidence that you are here after that. Thank you.
Yes.
Thank you. Thank you, Anup.
And Dr. Shabnam, very quickly, if anyone wants to get in touch with you, how could they
Okay.
do that?
So the best way is to reach out to my clinic, and I have something for women with PCOS. So this is 10 important numbers to know, and people can scan the QR code or type the drcarmd.com/PCOS10, and they can download this ebook. And I'm available on, LinkedIn and all the major channels. So I will end there, and maybe I can post the link to this particular download on your YouTube chat. So I will do that.
Yes, sure,
On.
sure. Yeah.
Okay. Thank
Yes.
you.
Thank you.
So we
Yes.
managed it right on time. Thank you.
Thank you.